First, we'll take a look at the normal anatomy and physiology of the lungs. Normally, the lungs function to bring oxygen into the body and to remove carbon dioxide from the body. The lungs are largely composed of spongy tissue with 2 lobes on the left and 3 on the right. The lungs are part of the respiratory tract. As we inhale, air moves in through the nose, passes through the nasopharynx and oropharynx into the trachea. The trachea then branches into the left and right bronchi, which further branch into bronchioles, which eventually terminate in sacs called alveoli. The alveoli are where the exchange of carbon dioxide and oxygen occurs. The gases move along the pressure gradient by simple diffusion from high concentration to low concentration across the cell membrane. Oxygen moves from the lungs into the blood, and carbon dioxide moves from the blood into the lungs for expiration. The exchange of these gases, in particular carbon dioxide, also maintains the acid-base balance of the body. Carbon dioxide readily reacts with water to form carbonic acid, which breaks down into bicarbonate ions and hydrogen ions. Too many or too few hydrogen ions can result in acidosis or alkalosis, or body conditions that are too acidic or too basic.
Lung cancer has the highest mortality rate of all cancers in both men and women. When cells multiply excessively and do not follow normal controls of cell division, abnormal masses of cells form. Masses can be benign or malignant. Malignant masses are cancerous.
There are several different types of lung cancers based on the cells present and where the tumors originate. Lung cancer itself is separated into 2 main categories, small cell lung cancer and non-small cell lung cancer, which is then further broken down into large cell lung cancer, adenocarcinoma, and squamous cell carcinoma.
Symptoms: hemoptysis, which is the coughing up of blood or finding blood in the sputum, occurs in 25 to 50% of lung cancer patients. It is caused by a tumor eroding through blood vessels in the central airway. 50 to 70% of patients have a cough that becomes persistent. This is due to a tumor in the central airway irritating cough receptors, and it is most common in squamous cell carcinoma. Dyspnea, which is difficulty breathing, occurs in 25% of patients with lung cancer. Dyspnea is caused by airway obstruction due to the cancer tumor invading the normal respiratory pathway.
Respiratory acidosis can occur as a result from an airway obstruction. In lung cancer, if a large tumor is present in a central bronchi, it can severely obstruct the airway, possibly causing respiratory acidosis. In this case, respiratory acidosis would occur from carbon dioxide being unable to effectively leave the lungs, causing a buildup of carbon dioxide. There are several causes or risk factors for lung cancer. The single largest cause of lung cancer is smoking. Only 25% of lung cancer cases are found in people who are considered never smokers. Prior inflammatory diseases and disorders such as chronic obstructive pulmonary disorder or asthma are also a risk factor, as well as family history, environmental tobacco smoke exposure, environmental exposure to things such as asbestos, arsenic, or radon, etc., as well as several susceptibility genes for lung cancer that are either classified as high risk, moderate risk, or common low risk. The majority of these genes are either moderate risk or low risk.
Cell membrane. Lung cancer affects the cell membrane due to the rapid uncontrollable cell division arising from epithelial cells within the lining of the bronchi.
Homeostasis. Lung cancer affects homeostasis in several ways. Lung cancer causes tumor, and these tumors can obstruct airways, which results in decreased ventilation. Decreased ventilation will then result in dyspnea and possibly hypoxia, which directly affect homeostasis.
In summary, the lungs function to exchange oxygen and carbon dioxide and to maintain acid-base balance within the body. Cancer is the uncontrolled growth of cells that ultimately disturbs normal body processes. Many lung cancers arise from the epithelial cells of the bronchi. Symptoms of lung cancer include coughing up blood, persistent cough, and dyspnea. The greatest risk factor for lung cancer is smoking. Other risk factors include environmental smoke, radon, asbestos, and genetics.